Hi, good morning, Dr. Stern.
Good morning.
Good morning. How are you today?
Just fine.
Good.
Yourself?
Not bad, not bad. Let
Great.
me just check. Can you see yourself clearly at your end, Dr. Stern?
Yes, I can.
Okay, so when you do talk, you'll see me with the little icon, and you'll see yourself on the screen, and it's very clear, right?
I can see me. I can't see you.
Okay, that's fine. Think, can you see
I
me
had
now?
to play around. I had to play around. There you are. Hi.
Hi. Okay, you
I
can
had to
see me
play
now.
around with the positioning here to make sure the lighting was acceptable. It's a little difficult. I can't do this at my office because we can't silence the phones.
Okay.
So I'm at my residence, and I had to find a place where I thought it would be okay and reasonably quiet.
Okay. Thank you so much for not troubling you too much to find a spot and away from your busy schedule.
Well, it's going to be worth it.
Okay, sounds good. So, what I'll do, Dr. Stern, is do a little introduction, just a brief about you. Once that is done, I'll just introduce you to the DCA TV, and if you want, you can just say thank you for being whichever, whatever you would prefer, and we'll
Sure.
just run through the questions that I think the CC has sent those to you, so you
Right.
should, yeah.
And I'm
Would
not
like a
using
screen.
I am not using a script. I don't have the questions with me, but I can answer them. I've gone over them.
Okay, yeah, that sounds good. So, and you won't be like looking on a screen or glancing down at all, right?
Nope.
Okay, all right.
I'll be looking at the camera.
Okay, yes. So, even when you're talking to me, I think what I see is you looking directly at me. So, if there's any time that you want me to like repeat the questions or you want to repeat the answer and just let me know because we'll be editing everything and taking out the parts that didn't work and noises and stuff. So we don't have
Okay.
to worry about that.
Okay. Most of my answers are just going to be in a few sentences, unless if you want me to go into more detail, you can just ask me. Could you tell me more about that or something like that?
Okay, sure. Yeah, as long as the answers are, a minute and a half is that would be perfect.
Okay.
Yeah, and when we do the video, the full video afterwards, just, as I said, we'll take everything out, so not to worry about that at
Sure.
all. I'll do an introduction to you, as I said, excuse me. If there's anything that you want me to correct later on, just let me know once we're done the interview, and
Sure.
I'll fix those things up and have the introduction the way that you like it as well, okay?
Yes, and I do have a few props that I'm going to use. I can just hold it pretty close, and I think they'll be able to see it.
Yes, yeah,
Okay.
yeah, that's,
Is my feed okay for you?
yeah, the feed is okay. When you write on the bottom, it's clear. So I think just when it's on full screen, it's not like perfectly clear. But if you're seeing yourself clear, and I see in the bottom there
Mm-hmm.
you're also clear, I think we're good to go.
Okay.
Okay. All right. So let me just do that. Shall we start then, Dr. Stern?
I think it's fine.
Okay. All right. Welcome to DCA TV. I'm your host, Salika J, and I'm here today with Dr. Michael Stern, dentist from the practice of Smile Brighter in Willoughby Hills in Ohio. Dr. Stern has attended Ohio State University, earning his bachelor's degree in microbiology and in dentistry. With over 10 years of practice, Dr. Stern is a highly experienced practitioner and has received a number of honors and awards in his career. Some of those he holds most dear include the fellowship degree of general dentistry, the American Academy of Pain Management, and the fellowship degree from the International College of Craniomandibular Orthopedics. Widely known in the area as an extensively trained dentist, Dr. Stern has enhanced the health and beauty of smiles for patients of all ages. working with several anchors from Fox 8 News, and formerly served as the official dentist for the Cleveland Browns. Memberships and credentials of Dr. Robertson include American Dental Association, Ohio Dental Association, Academy of Laser Dentistry, the President and the Director of Education with the Northern Ohio Dental Society, membership with the Health Tab, the world's leading interactive health network, and a member of the Board of Trustees with the North Coast Spring Dental Education Meeting. The training and expert skills behind Dr. Stern, although impressive, does not compare to the joy he feels in helping patients achieve healthy, beautiful smiles. We're delighted to speak to Dr. Stern today, which will give us a clear idea of some of the common questions you might have on dental implants. Welcome, Dr. TV, and thank you for being on the show today.
Absolute pleasure to be here. Thank you.
Great. So we will start with the first question, Dr. Stern, okay?
Okay.
All right. Dr. Stern, can you tell us what are dental implants used for?
Dental implants are used for several different reasons. One of the most useful reasons is if somebody is missing a tooth or teeth, dental implants are able to replace them in most cases, functioning as good as or better than the teeth that were lost. Dental implants are also used as anchors for full arch of teeth, whether it be bridge work or dentures. Dental implants are also used sometimes in orthodontics, and they are used as temporary anchors to allow orthodontists to move teeth with forces being applied that normally could not be done without having something more stable, like a dental implant.
Perfect. Okay. Dr. Stern, how will I know if implants can be done in my case?
That's a really good question. Implants are not for everybody. You have to have an adequate amount of bone in the area. Now, if you don't have an adequate amount of bone, quite often bone can nonetheless be added. That would be the first situation. Second situation would be if there are some health issues. If you get medical clearance from your physician, then you're good to go for implants. There aren't a lot of situations where implants are not indicated, but generally some studies are done that would be either conventional dental x-rays, or increasingly nowadays we do what's called cone beam imagery, which is, it's almost like a miniaturized version of a CAT scan or an MRI, and it can be used to scan the bone in the jaw in 3 dimensions, and that allows the doctors to see much better if you could be a candidate for dental implants.
Okay. Third question. Dr. Stern, dentist to get an implant done?
You're going to have to repeat that. I didn't quite get the wording.
Oh, sure.
Sorry.
Dr. Stern, how do I choose a dentist to get an implant done?
That's another good question. Most dentists in the modern era are trained to restore an implant that's already been placed. Some dentists do the implant placement surgically themselves. Other dentists will work with a team of surgeons that will evaluate the patient for implant placement, then surgically place the implants, and then release them to the general dentist to do the restorations. I would say the best way to choose one is either through a friend or associate that's had the work done, that's really, really happy with the results, or you can contact your local dental association or dental society for a referral, or generally you can go to a reputable dentist's website, and generally the website's going to tell you that dentist's involvement in implant technology, whether it's both placement and restorative phases, or whether it's just one or the other. So that would be a good place to start. Lacking that type of patients, the patient potentially could go to virtually any oral surgery office or a periodontal specialist office, and the majority of them are quite skilled in placing dental implants, and then they could refer you to a dentist to do the, whatever goes on the implant, whether it be a crown, a bridge, a tooth, or a denture.
Oh, question. Dr. Stern, what factors contribute to the long-term success of dental implants?
Factors include, I want to include long-term implant dental success, patient quality of care. If you're doing implants in a patient that never took care of their mouth, I would think that without extremely educating them in how to take care of the implants, which basically is the same thing you would do with natural teeth. If you don't take care of your oral environment, the implant is not going to last as long as it would normally. In terms of longevity of implants, this would be a good time to throw in the statistics. The best statistics we have on dental implants longevity comes from the Scandinavian countries where they were developed almost 50 years ago. And currently, because they have socialized medicine and dentistry and the patients are required to be checked on a regular basis, we can tell you with reliability that over the 46 years that we have data, you're looking at a 98% retention rate on implants in the lower jaw and somewhere around 90 to 92% retention rate of implants in the upper jaw. There is a difference because lower jawbone is generally a little bit denser than upper jawbone. And this, of course, would take into account all patient varieties, the ones that take care of things and the ones that don't take care of things. But like you see in so much of the advertising today, in the fine print, individual results may vary. In my own experience, I have seen very, very few implant cases fail, though.
All right, that was very informative for me, for sure.
Thank you.
Next question. Dr. Stern, who can place a dental implant in my mouth?
Once again, that's going to go back to a little bit about what I spoke towards earlier. The majority of oral surgeons and periodontal specialists are quite comfortable and proficient at placing implants. As I did mention, though, a growing number of dentists in the U.S. that do general dentistry, like myself, are qualified to place implants as well. And again, the way that you would find out regarding a general dentist's ability to place implants would be check their website, call their office. And again, as I mentioned, in the U.S., most dentists nowadays can restore implants, which means putting whatever it is that the implant's being placed to support in the mouth once the implant has been placed. I think statistically now, well over 45% of U.S. general dentists are now placing the implants, at least the simple ones, in their own office. But, you know, there's plenty of availability of information on the web regarding which dentists are proficient in doing this. And of course, again, if you talk to somebody that's already had the procedure done, if they're happy with the way things went, that's a good idea in terms of an initial follow-up to take care of that question, okay?
All right, perfect. Dr. Stern, are there any limitations?
Limitations would be few, but again, there are certain health conditions that might prohibit the use of dental implants. Those are very rare, but they do come up sometimes. Additionally, people that have lost teeth because they've cracked them due to tooth grinding or clenching, they may or may not be a candidate for dental implants. It depends on the judgment of the placing doctor. Most of the time, there are not a lot of limitations. If the person is in good health, and that can include people all the way up into the 90 years old range. My oldest implant patient is going to be 98 years old in 2 months. And she has had that implant in place since 1986, which I would consider to be, that was when I think implant surgery in this country at least was taking little baby steps. So there's a good variety of people that have implants, that have medical issues. Most of them do not prohibit the placement of dental implants.
Wow, 98. That's pretty exciting, I think. Dr. Stern, just for interest's sake, what's the age of your youngest patient who's had a dental implant?
The youngest patient that we did implant therapy on at the time was about 14, I believe, somewhere around 13 or 14. This young lady had been born without her lateral incisors, little side teeth next to your center ones, and that happens to be a common issue. And it used to be that orthodontists would move the teeth around and try and fill in the space with the bigger cuspid teeth, and then we would have to shave them or shape them, which was a compromise. So we sort of stuck our neck out on this case, and together, myself and the orthodontist decided that we would do her tooth straightening, leaving the spaces for implants to be placed. The challenge came, and this was several years ago, the challenge came in that most of the time people are reluctant to place implants on patients that are much under the age of 20, and that is because we don't have enough studies available on how future growth of the body around the surgical site might affect the positioning or longevity of the implants. We were able to find a trailblazer in the implant therapy business locally in our neck of the woods, who had also written several books on implant placement. He said, sure, we'll put them in there. So at about the age of 13 or 14, he got the implants placed. This was, again, several years ago. And we held our breath. We did all the work. And this is like 4 or 5 years later. Everything looks super. So that's a lengthy answer to a short question.
Definitely interesting to hear such cases like that. So that was good.
Good for everybody.
Yes, definitely. Okay, next question, Dr. Stern. Dr. Stern, what might be some of the factors that would prevent me from being an implant candidate?
As I mentioned earlier, certain medical conditions, most notably mitral valve prolapse, artificial heart valves, anything involving the internal mechanisms of the heart. I think for most people, that's probably the biggest question mark, and we have to get medical clearance on an individual basis. Also, if somebody had an autoimmune disease like, let's say, lupus, for example, if they had HIV, for example, that would have to be cleared by their physician. If they had a metal allergy, we would have to make sure that it's not to titanium, which is what the implants are made out of. So far, I haven't seen anybody that couldn't tolerate the metal in the implants, again, which is surgical grade titanium. But I do think there's a couple cases in the literature where that was the case and somebody could not tolerate it. Lastly, if we saw somebody that has so little jawbone left or anatomic variables such that placing an implant would impinge on vital structures like perhaps arteries or nerves, then that would be a big no-no. But again, with the more advanced imaging that's coming out now, like cone beam, as I discussed earlier, that's much less likely to occur. I hope that helps.
Yes, definitely. Well, 2 more questions, Dr. Stern, so we're almost there. Okay. Excuse me. Next question. Dr. Stern, how will I clean around my implant?
Great question. In reality, an implant, and I'm hoping that you folks can see this, This is on a model here. So an implant for a single tooth, represented by this area here, you can see that there is an implant in the jaw, and there is a crown on top of it. And that is cleaned no differently than the other teeth are cleaned. Brushing and flossing is sufficient, okay? If you have a situation where we have somebody that's lost all of their teeth, they may have a denture that goes over dental implants that are anchored into the jawbone thusly. Again, obviously this is a model. The implants would be exposed for cleaning when the denture is removed, and that is a very, very, very easy process. Occasionally, implants are placed at an angle other than the normal angle because of available bone. And in those situations, your dentist may give you some additional instructions, but for the most part, it's really no different cleaning an implant or an implant bridge than it is cleaning around a regular tooth or a regular tooth supported bridge.
Perfect. So last question, and I'm pretty sure a lot of us would be definitely wanting to know the answer to this. Dr. Stern, how much does an implant cost as compared to other forms of dentistry?
Great question. I think rather than give specific figures, because I know fees can vary in different parts of the country, let's again go to a model. If you had to have a crown done to save a tooth, we're not about an implant crown, but just say a regular crown, okay? That would be our base figure. Now, let's say that you lost a tooth, goodbye, and you wanted to do a replacement. One way to do it is with a bridge, which involves working on teeth on either side of the space. So if you wanted to do a crown, that would be a multiplier of 1. Doing a bridge would be a multiplier of 3. So you'd be looking at an investment probably 3 times more to replace a missing tooth with a conventional dental bridge than you would just trying to save the tooth in the first place. That being said, if you were going to replace the missing tooth by having an implant placed in, when you let the dust settle after the implant placement and the tooth being reconstructed and everything, you're probably looking between a multiplier of 3 and 4. So implant therapy is a great investment. It is more expensive than doing a bridge, but the advantage of an implant is the incredible success rate. I don't think we have anything in dentistry that has a higher success rate than implant dentistry does. That's the first thing to consider. The second thing to consider is that, again, if you were going to go with a conventional dental bridge, the doctor has to do something to reduce or shave the teeth on either side that would anchor the replacement tooth, okay? And a lot of people don't want healthy teeth to be treated in that manner, so you're paying a little bit more for an implant therapy replacement for a single tooth than a regular bridge. But that being said, you're not doing anything to the adjacent teeth, which for a lot of people is very, very influential in their final decision. If you get into replacing entire arches of teeth, let's say the whole lower or the whole upper, I'm sure some of you folks have seen the infomercials on TV for the chain of clinics across the country that does the entire thing, you know, lickety split. It's really not quite as fast as they say, but the fees in that situation per arch can be upwards of $25,000. We don't see a lot of people that need that. People can do an entire mouth, as I showed you earlier, with a denture for much, much, much less than that. But implant therapy, with all of its advantages, it's generally going to cost you more. Okay?
Okay, well, those are all the questions, Dr. Stern, and thank you for that answer to the last question. So it was very helpful.
Great.
So those are all the questions. Is there anything in the introduction that I need to change or add anything that you might have heard when I did it at the start, Dr. Stern?
I don't think so. I think I was just sitting there saying, "Wow, that's a lot." I hope I,
Okay.
I hope we don't lose any viewers as you're going through all the credentials.
Yes, or I can maybe if you want to, I can make it take a little stuff things out, but then again, I definitely want to, inter to keep those things because then I'd be wanting
Yeah,
to that have that on the introduction. So let's see, because maybe once the edits are done, it could be just, that it goes really fast. So
sure,
we'll see how it goes. And if there, like I said, if there's anything that when we send the video to you and you think it's too long and we need to make it short, we can do all that after
sure.
as well. Yeah. And I was wondering, do you want, since this is one topic, Dr. Stern, on dental implants, is it okay that we do one little short multiple short videos done on each question? Like, what would you prefer?
Um, I think I had mentioned one other topic that I'd be interested in. It might have been cosmetic dentistry, perhaps.
Okay.
But you know something, if if you needed somebody just to field questions, I can do
Mhm.
that too. I mean, I've been practicing for actually over 30 years, and I've seen pretty much everything. So there aren't too many things that I would get stumped on. I think one thing that I'm involved in that I didn't mention, and it might be a topic of interest. I'm working right now with a few physicians on a way to reduce people's cardiovascular death rate, and it involves doing oral DNA testing, determining which bacteria are in the mouth, and doing a genetic test also. And this is all done just from a salivary sample. Basically, somebody spits in a test tube, and we have it analyzed chromoscopically and do DNA analysis, and we can actually help people that are struggling with controlling their blood sugar, if they have severe diabetes, if that one blood factor that is always called A1C, which is very crucial to your long-term health, if that is a problem, we are able to, through the bacterial analysis, prescribe very simple home treatments that can alleviate the overgrowth of the bad bacteria and even partially overcome the effects of just basically having bad genetics that would make you more prone to gum disease and tooth loss. That is something that very few dentists are involved in. We are involved in that in the greater Cleveland area, which I also serve, with a specially trained physician as well, and we cross-refer patients for this purpose. That would be a whole other thing to open up, and it would probably be something that most of your viewers have never even heard of. And we do talk about that a little bit on our website. If you decided you wanted to go in there and look at it, it's under non-surgical treatment of gum disease. I also have a TV interview embedded in my website where I was actually interviewed regarding oral DNA testing and some of the things that we do with that. So that would probably be something that you're going to get very few other doctors that even know about this.
Yeah, and like since you mentioned it, it's the first time I've heard it. So I think even
Sure.
patients or viewers would definitely would like to hear more about that. So
For
maybe I
sure.
was thinking in the future, maybe we can do one on that DNA, oral DNA testing, and a
Sure.
little interview, and then also on cosmetic dentistry as well,
Sure.
if you'd be
That'd be great.
interested. Yeah, so what I'll do is I'll work with the client coordinator and just do the same thing. We can schedule a time and
Sure.
maybe we can run both interviews on the same day, whichever, looking at your schedule as well. And
Sure.
I think that'd
Sure.
be very good to do.
Yeah, and like I said, if you wanted to get an idea of what the questions would be like, regarding oral DNA, you can just go to that TV interview that's on my website about oral DNA, and you can see
Hmm.
what the interviewer did there. We can do something similar, or you can, you know, generate some other questions as well. That would be great for everybody, I think.
Yeah, that definitely sounds very interesting, and I think we can even put it on DCA TV again, just like this one. So definitely be interested in doing those two with you in the future. So what I'll do, Dr. Stern, is send this off to our edits, create the video, take out all this stuff that we're talking about, and make the video, send it to you for your approval, and we'll go on from there.
Excellent.
Yes, so thank you so much for your time, Dr. Stern, today, and for being with us on DCA TV. It was definitely a pleasure.
My pleasure as well. Thanks so much.
Okay, so we'll be in touch in the near future for sure. Have a great day.
You too. Thanks again, okay?
All right,
Bye-bye.
take care. Bye-bye.
Bye now.